group of communities around the country is concerned about losing access to medical care after one of America's largest private for-profit hospital chains filed for bankruptcy yesterday. CBS News has reported on Steward Health Care as part of a nearly 2-year investigation where we looked at how private equity-backed companies buy hospitals, then sell the buildings to make money, and then some of the hospital systems find themselves without the resources to continue to fully serve the communities. And it looks like what many were worried about is happening here. Chief Medical Correspondent Dr. John LaPook has covered this unfolding crisis from the start. John, good morning.
Morning, Natalie. Steward owns about 30 facilities across the United States. Some of them are small-town hospitals that have taken care of families over generations. Now those families and their communities are in jeopardy, worried about the future and wondering about all that money.
After Steward Health Care declared bankruptcy, Massachusetts Governor Maura Healey insisted 8 hospitals run by the company in her state will remain open.
Patients should keep your appointments.
Despite those assurances, the company's early morning filing listing debts of at least $550 million left frontline workers like nurse Audra Sprague reeling.
How does this all leave you feeling?
Angry. This one company is going to come in and just destroy it and walk away and probably have no repercussions for it.
Beginning in 2010, Steward snapped up dozens of community hospitals across 8 states with backing from private equity investors. In recent years, the company has struggled, shuttering hospitals and leaving an extensive trail of unpaid bills that led to shortages of life-saving medical supplies. Last year at this Steward Hospital in Boston, a 39-year-old woman died after giving birth to her daughter. Weeks before, a device that potentially might have saved her life was repossessed by a vendor Steward hadn't paid. Mary Bugbee is a senior coordinator for the Private Equity Stakeholder Project, a nonprofit that looks at the impact of private equity investments.
Where does that all leave the people who are working in the hospitals, the patients?
So they're the collateral damage, and this is a lesson in moral hazard. These private equity investors get to make a lot of money and take financial risks, but the cost of those risks are borne by the patients, the workers, and the communities those hospitals serve.
In a statement announcing the bankruptcy, Steward CEO Ralph De La Torre said the company had done everything in its power to operate successfully in a highly challenging healthcare environment. An SEC filing from 2021 revealed Steward's owners paid themselves millions in dividends. Around the same time, De La Torre acquired this 190-foot yacht estimated to be worth $40 million.
That this situation stems from and is rooted in greed, mismanagement, and lack of transparency.
Steward Health Care said declaring bankruptcy allows it to continue providing care to its 2.2 million patients nationwide without disruption. Ultimately, a bankruptcy court will help decide the fate of Steward's hospitals.
And Dr. LaPook, you've been warning about this for a while now. What needs to happen now to prevent this from continuing to happen in these communities?
Yeah, transparency. So, what we're seeing happening is that, these private equity-backed companies come in very often to distressed communities and under-resourced and people who don't have the same kind of backing financially as other communities. And they say, look, this hospital system was going to fail. And so we're coming in as a last-ditch effort, and we're going to try to rescue it, okay? And then, but there's no transparency, so you don't know what exactly is happening, how much of the resources are going back into the hospital system that's, underserved and underprivileged community, and how much is going back into their pockets.
It's just jarring to hear a hospital, guys, filing for bankruptcy.
Right.
Yeah.
And those two
especially
words,
in the communities that need it.
Yes.
Yeah, and
it doesn't seem to go together to me.
I think what you're going to be seeing, and it leaves the communities, sort of, wondering on what's going to happen. And I think what you're going to see now is legislation around the country that pushes for more transparency. Senator Markey said yesterday that that's exactly the kind of thing they're contemplating. And look, without transparency, these companies, you never know what's happening, and they can always just say, look, we tried the best we can. It was the pandemic, it was poor reimbursement, it was the conditions, and you never know, what was the actual truth here.
They're really in it for the money.
Yeah, and that's why covering these stories matter. Dr. John LaPook, thank you so much.